You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. This is a special episode, is an episode with a cardiac surgeon, a name that I do not think needs any introduction. I have the honor of having with me on the show today, Dr. Smith. Dr. Craig Smith is chairman of the Department of Surgery at the Columbia University Medical Center at New York Presbyterian Hospital. He's a cardiac surgeon, performed the quadruple bypass that saved former President Bill Clinton's life in 2004. We all know him through his pioneering work in cardiac surgery. I actually was privileged to hear one of his late-breaking presentations at the American College of Cardiology annual scientific sessions when I was graduating from Beth Israel Deaconess Medical Center as an interventional fellow in 2016, when he was presenting data on intermediate risk transcatheter aortic valve replacement patients. I'm not sure if he will remember that I was, one member in the vast audience there. One more thing in the introduction here is that Dr. Smith actually has come up with an excellent memoir, his book, which is titled Nobility in Small Things, A Surgeon's Path, which he's authored and has been published actually earlier this week on October 10th. And I have a copy. He'll tell us more about this book, which is what this podcast is about. And I encourage all our listeners to grab a copy as soon as you can, because I've started reading the book and it's hard for me to keep it down, between patients and spending time with my own boys. So with that introduction, Dr. Smith, welcome on the show, and thank you so much for doing this for us.
Well, it's my pleasure. Thank you for your kind introduction. I don't remember that. I don't remember you at that lecture, but I do remember that lecture.
Yes, it was a simultaneous New England paper as well. So thank you for all that you've done to advance the field, as well as thank you for all the pioneering efforts in cardiac surgery for your patients. So I'm going to start this conversation by asking you the motivation to write this book, which is a beautiful book, by the way. So congratulations on the publication of this book.
Well, I would say a large part of it was driven practically because of the interest that followed the things that I was writing during the COVID first surge in New York City in March of 2020. I just feeling that my department that I'm supposed to lead needed help with information and reassurance and even inspiration to try to get through the whatever was ahead of us, which at that point we had no idea what was ahead of us. But I felt I had to do something. We weren't making money for the department. So I sat down and started writing these communications, essentially emails, every day. Kept it up for 59 straight days. So the practical result of that was that they ended up getting a lot of attention. In my small world, I suppose that you could say they were viral, but they acquired an audience far beyond my department, the intended audience. And so not long after things had sort of died down in late spring 2020, I started having interest expressed by agents and publishers in doing a book. So I went through that process and picked a publisher and an agent, and here we are. So I feel, obviously, I'm very grateful, and I'm aware of how privileged that story sounds compared to real writers who struggle for years, even to get the attention of an agent, let alone a publisher. So having this sort of delivered to me was a great honor and something I'm grateful for. But I did not sit down like in 2015 and say, in a few years, I ought to write a book. It just kind of happened. So that's where we are.
Yes, organic outcome, you bring up some of the emails that you started writing for the intended audience, which were your department members, and how those writings, went beyond the four walls of your division or your department at the Department of Surgery at Columbia University Medical Center. I actually stumbled upon your writings during the pandemic. And you correct me if I'm wrong. I know that the Wall Street Journal in quotes says here that it's the New York's most powerful writer in Scrubs, and certainly you became the voice of the pandemic. I was in Cleveland at the time. I was at the Cleveland Clinic, and I started reading what you were writing. I believe through the New York Times. Correct me if I'm wrong, because they were getting posted online or they were getting posted on LinkedIn, but there was an online medium through which I was accessing what you were sharing each of those 59 days. Well,
you're not alone. And I had no idea until it was almost over how many people were in the same boat. And I can't honestly tell you who was putting it on in different places. I know that my department, we have a group of people in the department who are supposed to manage social media and what you would call marketing if this were just a company. And they were responsible for circulating what I wrote each day to everybody in the department. But the people who managed that ended up with an increasingly long list of other people to circulate it to. Some of them were people who called me and said, can I be on the list? Or they called other people. And I can't honestly tell you how he curated that list or whether he sent it to more than LinkedIn and so on. But I know it was, to my amazement, all over the place. I mean, it's another privilege to have that kind of audience put in front of you.
Yes. So, which I mean, I'm sure the fact that when people read it, and I read some of, I haven't read all 59 of those or 60 of those, but I did read quite a few of those, and the way they were orchestrated, the way they painted the human emotion, the way they painted the struggles, the way they painted how each one of us was experiencing the pandemic. They struck an immediate chord with the human experience, for lack of a better word. What describe to the listenership here what you were going through at a personal level, obviously consuming all that was being put out in the media, and in the press, and how it changed your world or your viewpoint of life, of the world, and of what we do in medicine.
That's several questions all together. Let me, if I can remember them all. What was it for me personally was, I think, how you started. And I can take that a little bit. The most obvious thing at the beginning was that me and people like me who'd spent, in my case, 38 years or whatever it was, operating all the time, doing this essentially one thing that's time-consuming, highly rewarding, absorbing, doing that for all those years, day in, day out, to have that, and then suddenly that was gone. Like from Friday, the following Monday, we just didn't do that anymore for several months. So it would be hard to know exactly what their best analogy is, but it'd be like being thrown in jail, taken out of your productive office and thrown in jail for a few months and had nothing to do. So that was some of it. I didn't have nothing to do because I did feel that it was very important for me to do what I could do to lead the department, which is, after all, my job. And what could I do when I couldn't lead them by doing operations and helping other people do operations and bringing in revenue that supports our research and teaching and all? What could I do? Well, I decided what I had to try to do was to inform the audience. You could do the best synthesis of all that stuff slopping around every day that I could do and put it in simple terms that would inform. That was number one. And then try to reassure people that someone's hand was at the helm and that we were thinking about the issues ahead and how to get there. So that turned out to fill my absent OR time pretty well. I think one of the questions you asked along the way, or you sort of implied that I must be studying the pandemic. Well, I was, I guess, to an extent. I'm not sure I was publishing it any more meticulously and scientifically than many other people, but I sure grabbed on to the things that seemed most relevant day by day, and I paid close attention to we had meetings with the leadership of the hospital and the university practically every day, sometimes many times a day, talk about the latest numbers and the latest supply and this and that. And those were things that don't get your attention very easily in another setting, but in that setting, I paid close attention to those things, and they were often the backbone of what I would say that day. And it fell into a pattern, sort of, with a paragraph or so of structure around or practical tidbits that are built around those things. Like, today we have so many masks, and tomorrow we have this coming, and things like that. And then move from the practical. So here are the facts on the ground, then move from the practical to something a little bit more, if not symbolic, at least a little bit more human, about a variety of things, what we must be feeling, what other people are feeling, what's our mission, are there examples from history of comparable missions that were met in certain ways. And then I would try to wrap it up with something that was, if not inspirational, uplifting, encouraging. I tried very hard never to end on a bummer. And so that was the plan. I looked at each one of them like, the mental model I had was a popular song. And, popular songs are all about 3.5 minutes long. And that's about someone's attention span for something like this. So I aimed to write something you could read in a few minutes and just have it have those three elements. Now, I've probably forgotten some of the other things you asked in your question.
No, this is a fantastic answer. And, what I wanted to ask you as a follow-up to the answer is, as a chair of a prominent department and division, and doing what you do on a daily basis, which is highly skilled work, and then being thrown into the throes of the pandemic, and New York certainly was one of the first cities which was very heavily hit. We were following the news across the spectrum of how news is delivered in 2020, I guess in 2020 and 2023. And what was it in you which was such a calling that you had to do this for your colleagues? Because and the reason I asked this question is that wherever that calling was coming from, whatever that place was inside you, inside your heart, in your soul, was such a pure place, because it has to be pure for it to have hit, for it to have hit so many people emotionally, and for you to have struck such a chord. And that's the reason why I asked this question.
It's a very flattering question. You make me feel like Gandhi or Churchill or something, I wish I could say that it came from some deep well of genius of some kind. I didn't think of it that way. I really thought, this is what I'm supposed to do. we're all immobilized, at least immobilized as defined by the things we're accustomed to doing every day. And we have to respond. It seemed obvious that everyone in medicine, let alone my department, was going to have to try to find a role to play in this unprecedented healthcare crisis. And that response has to be led by the leaders. So by definition, I was the leader of my department. It was my responsibility to take care of that. And I really didn't think of it in such glorified terms. It's very kind of you to say, and maybe I'm more glorified than I think, but it was, it evolved out of a little more practical mental space, I'd say.
Yes. And, I think it's, what I said comes from an honest space, a true space as a reader of your writings. And I also asked this question because, I'm a poet and a writer myself. And I think each time I'm trying to write something which is philosophical or which, I'm trying to share a human emotion, I truly, truly want to parse it through, the various sieves of, ego and, in terms of who I think I am, but who I truly am. And, the reason I'm getting to this question is, the reason is because, as I was going through the contents of the book, this is a deep philosophical book. It's 16 chapters and it starts off with, or I would say, 16, sections, if not chapters, if you will. And then, these sections are the way they are, labeled, or, what their headings are, are deeply, deeply philosophical. And that is the reason, that was the motivation of my question. So, but getting to these 16 sections, and I don't want this to be a spoiler alert of any kind, but would you like to walk the listeners through the book?
Sure. And thank you for thinking I put some thought into my title and my chapter titles and subheadings, because I did. So thank you for thinking there's more to it than just chronology. But to walk you through it, I started out with, how did I get where I am? That obviously takes me into the realm of memoir, inevitably going into the realm of autobiography and memoir by explaining how I got where I am. And why did I think that was worth explaining? Because I think that I didn't follow a straight path from, high school into college, into medical school, the way most doctors probably do, especially then. And I had fluctuating motivations and fluctuating goals. And in the course of all those years, did some things that I was very lucky to survive, quite honestly, just plain lucky, and showed bad judgment in any number of realms, and was able to stumble through and figure it out and land where I probably knew I wanted to land, but had to wander for a while to come back to it.
Tell us more about those places, because, I think, in part, Parallax is a memoir of physicians and cardiologists we all look up to. And I think when we do that here at Parallax, we are wanting to get behind the person we know only through, New England Journal of Medicine papers or the American College of Cardiology late breakers, but there's a lot more to it. And so I think this is that safe platform where we get to know the humans. So I'd be very, very interested and keen and curious to learn about all those detours of yours, because, obviously they had a lot to do in how you are, where you are now and how you are today.
I'll try to give you a more focused answer than I was giving you then, because let's say I'm talking about the first, say, 4 chapters before I actually became a doctor. And when I was junior high school age, I was all about athletics. That's almost all I cared about. I did reasonably well in school, but not all that well. There were parts of school that came easily to me, like writing, reading, and so on. Parts of school that didn't come easily at all, like math. But I was really all about playing football and lacrosse and wrestling, whatever. I did all kinds of things. And when I was very fortunate to get into a good college, Williams College. I was actually, I arrived on campus completely paranoid about what I think is actually the fact that I was probably the last person taken in my class. I was snatched off the waiting list in something like August. And I had the highest ID number of anybody I knew at my college. So I assumed I was the last guy in. I didn't think I'd last a semester. But something about college clicked for me, and I started studying, doing the work. I was playing football and lacrosse and all, but I was doing the work. And college was like a new world. And against all odds, I turned out to do quite well. So in college, a bunch of injuries, and my athletic career was on balance, disappointing throughout, I'd say. And a bunch of injuries finally ended it. But I can't say I missed it. So by the time I was well into college, I had this new world of the creativity in science, creativity in philosophy, other things. I took college pretty seriously. Took all the courses I could take that interested me. Did the work. I still hung out with all my crazy friends, but did the work. But that produced a shift in focus. I decided, well, I'd been focused on medical school the first couple of years, had all the pre-med requirements out of the way. Maybe I should be a scientist. So I went off on this tangent, pursuing a PhD in biophysics for a couple of years. Total mismatch of personality that I should have realized sooner than I did, but be that as it may. Devoted 2 years to it. Actually ended up doing a very interesting project that if I'd finished it, might have been quite interesting. But for a host of reasons I won't bore you with, it's discussed in the book. I dropped out of graduate school. So then I had some time to fill. Now, I guess backing up to what is discussed in the book, during my summers in college, I worked in a steel mill in Philadelphia a couple of summers. Hot, dangerous, dirty work. Got badly injured, almost killed, literally. Almost twice, almost killed in one part of that job. Recovered from all that. So fast forward, dropped out of graduate school. Then I had some time to fill. I was still trying to think, what do I want to do? Do I want to go to medical school? I had to have a job. So I got a job as a telephone lineman in White River Junction, Vermont, and spent a little over a year doing that. Now, that's quite an interesting job. And the people you work with in rural Vermont are very interesting people, very impressive people. People in the steel mill are impressive in their own ways, too. I mean, one of the things I think the journey of my life has taught me is how interesting and how individual, how unique individuals are in all walks of life. But as it may, I was a telephone lineman for a little over a year. That's well covered in the book. And during that time, decided medical school is for me. So I applied, fortunate enough to get in despite that checkered tail. And off I went. So, and I think I also say in the book, medical school, most people find this hard to believe, easiest 4 years of my life. No motivational problems at all. I knew what I was there for. I had to absorb a body of knowledge and acquire the skills necessary to become a doctor. And it just seems so stressless and easy. Just do the work. And did fine in medical school, got a good residency and all. That's where from there on, the path is much more straight and narrow. But it did take me a while to get there. I'll pause for breath for you and me. Am I covering what you want to hear?
Yeah, no, this is excellent. This is exactly what what the motivation was for my question. And thank you for sharing that with us, with the listenership, so vividly. So if anyone who's following and who wants to take this episode as a preamble to the book, which again I encourage all of us to pick up a copy. We are now into section 4 and section 5, and it's a perfect place to stop, because section 5 and the way it's titled is just fascinating. And it's titled Making Sausage. And it's got 4 components to it, for lack of a better word, or 4 sections to it. And you can correct me, Dr. Smith, if I'm wrong here. Which is Rochester, Roads Not Taken, then Columbia Presbyterian, and Thanksgiving. Do you want to take a deep dive into this section for us, just because of how interesting it is, making sausage?
Well, in essence, it's about how doctors are made in the residency process, and takes you through my general surgery and vascular fellowship in Rochester, and through my cardiac surgery residency in New York, and all the stresses and trials and tribulations that go along with that, and the pleasures of it, I hope, come through as well. But those are difficult years for anyone. But they're also years, and I don't know if I make this clear enough, this particular point, there are years that go by very fast. And that's partly because you are learning so much, doing so much, so absorbed, so involved in something that seems larger than yourself, that it just flies by. But it's a lot of work. And those years that are covered in that chapter, how the sausage was made then would be considered barbaric by the standards of today. And I get where they're coming from, but they trained me awfully well. And there were a lot of doctors of my generation and generations before me who had the benefit of very good training and ended up highly skilled. But there's no short pathway to those skills. Stresses were different in both places. I had this, going to New York was quite a psychological challenge for me, because I always been terrified of New York. And then I had, because of the way the system worked in those days, I had 2 years from the time I was accepted for that cardiac residency. I had 2 years to worry about whether I would succeed in it. And in this big city that still partially terrified me. But by then I'd bitten I'd taken the bait, and I could see that there was something really big maybe down there. Columbia Presbyterian is one of the few places then doing any heart transplant, and that sounded kind of exciting. And they had great congenital surgery, and my visits had shown me what a complex place it was. And it's a place, and this is true today and was true then, it's a place that can be overwhelmingly intimidating if it's not your cup of tea. But it just stuck with me, and and maybe that's something wrong in me that makes those kinds of experiences so interesting. And maybe that leads back to the swerves that I took earlier in life. Maybe not, but it covers those years that are, so there's so much in them, but they're over so fast.
Yes. And, from the years and from the detours in your early life, until you were in college and medical school, were there any experiences you think which made it easier for you to survive the residency years? And I mean, I think, I completely agree with you. I think the years as house staff and then as a fellow are some of the most beautiful years I consider, in my own path. And, I'm still early career. I'm only 6 years out of fellowship. But you've had such rich experiences before your introduction to college and medical school. Were there any particular traits, experiences which made you more resilient as a house staff in cardiac surgery?
Well, I'd say I was more resilient in part because I'd by then gone through and recovered from a lot of injuries that are talked about in the book, and I won't drag you through it. But I've been a patient in hospitals several times for not long periods of time, and all my injuries were recoverable, but there were a fair number of them. And each injury like that, when you're a teenager or a young kid, I think is maturing. And if you're fortunate enough to have a recoverable injury and get through it okay, it matures you and makes you more resilient, gives you a little bit more grit. So I had that. And then by the time I got to be in residency, I'd also been scorched in the fire of some difficult employment. So the 2 summers in the steel mill, that's tough, dangerous, dirty work. And then in the telephone company as a lineman, same kind of thing. In both places, I would say more impressively, more obviously in the line crew, because it was a different sort of, these are rural country people, and they're very compelling people. And in some, that you get a kind of resilience from that by learning that you can work hard and that you can work past what you think you can do. And also you learn how hard other people work and how people in what most might consider dead-end jobs, how they they show respect for their jobs and for themselves and the way they do them. And there are people who work very hard and don't get all the privileges that go along with being a doctor. I think probably more than any other single thing, that awareness was sort of hammered into me over all those years. And that certainly helps with residency. And there were some practical things. I mean, I learned how to, in the steel mill you work, it's a 24/7 operation, and learn how to work through the night and work all shifts. And so when you go to medical school or go to residency and you have to be up most of the night doing something, you've done that before. You know you'll get through it. You'll catch the sleep up sometime. So I'd say all those things did help me prepare for residency.
Yes, and I want to talk about Section 8 of the book, which is, titled "Bypassing a President," and this is when you operated on former President Bill Clinton. Walk us through that section of the book. I haven't gotten there, but I'd be remiss if I didn't ask you in person.
That's right. It's ironic. Somebody just yesterday told me, well, everybody's reading that chapter first. I thought, well, that's interesting, because to me, it's one of the most uninteresting chapters when I go back and read through it, because it's just reporting for the most part. At least that's how I respond to it. I don't think I would have been satisfied if it was pure reporting, but compared to other chapters, it's reporting an event. But it was quite an event. There's no getting away from that. I'm not going to stand here and pretend to minimize that. And there's an awful lot I left out. And I would say that I guess I should be careful how much I say about it too, because part of the reason I left out a lot of the detail is because an event like that doesn't always cast our profession in the most flattering light. And I just don't like to be too negative about things. But in an event like that, some really unadmirable behavior comes up. What we do is supposed to be about the patient, not about our own careers or our own moment in the spotlight or our institution's moment in the spotlight. It is all those things. And believe me, I was grateful to have the attention, have the reputational boost of doing that. And I know my institutions were as well. But I honestly did soft pedal a fair amount of the bad behavior. Some of it's still there, but I'd say the thing everyone asks is how could it not be incredibly stressful? Well, it had its stresses, but the thing I may or may not make clear in the chapter is that because it was the event itself, the thing I had to do for the president was very routine to me. I realize that doesn't make it routine to the president or to anybody else, but it was routine to me and my team. And the president, like everybody else, deserved the safe harbor of routine. And our goal was, and to the best we could, I think we delivered on that, was to make his encounter as routine as we could make it. Now, obviously, a lot of routine goes out the window when you have Secret Service in the operating room, or at least you would think a lot of routine goes out the window. And when you have to take over a wing of the hospital so that the Secret Service can keep him from being, whatever is in their minds during his hospital stay. And the amount of media attention and all, it's just, that's not normal. I'm not going to pretend that is. But when it comes down to the specific encounters that are the doctor-patient encounters for me and the president, meeting him, examining him, studying his angiograms, deciding what to do, picking a team to work on it, picking a day and getting it all set up, and then going in the room and doing the case, that we kept as routine as we could. And it was really quite routine. His operation was relatively straightforward in the bigger picture of coronary surgery. So all of that we could rest on. And another thing I have told many people, and I can't remember if I say this exactly in the book, but I truly did not realize what a big deal this was. And this is the absolute truth. I did not realize what a big thing this was until I walked out into the lobby for the first press conference. Then I got it. And that day I'd come in, 5:30 in the morning or something. There were a lot of press trucks around, but there was nobody else around. I went into my office, did my thing, went to the operating room. He went to the ICU, and they had this press conference up. And I walked into this lobby through this little back door, and the place was packed to the rafters. And went up on the dais with my colleagues and answered questions and so on. That's when I realized that this was just all over the world in real time. And that was great. I mean, I often don't do well in those. Sometimes I don't do well in those settings. I don't live for being in front of the press, but everybody should have the chance to feel so admired at least once in their life. So it was quite an event. And the other part that I try to emphasize when this question comes up is that Bill Clinton and the Clintons as a family were great to work with. Just good people, straightforward. I mean, compared to many VIPs or wealthy people, most of them are fine to work with too, but not all. They can be very difficult, very demanding, very unreasonable. There's a sort of a syndrome among people like that they will look around until they find somebody who will give them what they think they want, not someone whose judgment they should be trusting. Surround themselves with people whose career depends on taking care of people like them rather than on medicine per se. So a lot of pitfalls in that, but they were great patients. He was great to work with. Hillary was great to work with. I didn't have much contact with Chelsea, but mostly with Bill and Hillary. They were good to work with.
Yeah, no, I had goosebumps as I was listening to you. And I think the part that I, liked the most, I think you said something which, again, really struck a chord, which, again, just completely just, shines a light on the human in you, is that you would want every human to be admired the way you were admired when you operated on him. I just to say that, for you to say that was just incredible to hear. Because, to have a celebrated career like yours would be any professional's dream. And to then have you speak those words with such humility just shines the human in you. So thank you for saying those words. I do want to talk to you about religion, which is, section 9 or chapter 9 of the book. And I wanted to talk to you about this because, this is an important topic of discussion for, I personally think, for physicians as well as for the scientific community. And I even bring this up because there is a paper which is going to be coming out in the European Heart Journal, which I'm a co-author, which talks about religiosity and spirituality as a medical prescription. And when I saw this chapter, I was enamored that a surgeon of your stature would write about religion. Talk to us about that a little bit.
Well, have you read the chapter?
I have not. I have not read the chapter. Then
you might be. You'll probably find that the title is misleading. Is it deliberately misleading? Perhaps. You now singled out the chapter that is my wife's least favorite chapter in the book, and it's one that I added back in. I wrote the draft. It went in, it came out. It went in, it came out. Ended up back in. And then there was some discussion about where to put it once my editor and I had decided that we liked it. Because it's about religion, but from my experience of it. And my experience of it is not what many people would call devout or spiritual, maybe in the sense that the title implies, that the chapter title implies. But that, I'm sorry to say, better for worse, that is my experience with religion. And there are good things about it, too. One of the things I mentioned is in my brief sojourn as a Congregationalist in Chicago in 8th grade, when I was confirmed in the local Congregational church, they, as part of the confirmation training process, which is probably similar in outline to a similar step in religion that many religions go through. They, reach that age. It's like a bar mitzvah or something, or that age about when you're just becoming a mature adult or about to be a mature adult, and sort of interesting time in life. Nonetheless, part of it involved teaching Bible and all those kinds of things. We also visited other churches all over the city of Chicago. And that actually was fascinating to me because they were all so different, but all so much the same, that it gave me the feeling that whatever you want to define as religion or as religiosity or the spirit philosophy that is behind it, they have a lot more in common than separates them. So the Greek Orthodox service may be very different than a Quaker service or a Jewish service or Catholic service, and we went to them all, but they all seem to spring from a common well. And that to me was an important take-home lesson. And I had to credit my church at the time, if that was what they were intending to show, and credit to them for making the point. I'm not sure it was what they were trying to show, and I turned out not to be a long-term success in their minds. Anyway, when you get to the chapter, see if it resonates at all. I wind through some territory that will just, typical adolescent bad behavior and stuff too. You'll get there.
Yeah, no, I certainly am looking forward to going through the book in the right chronology, and because I have to be honest with you, I have been enticed to get to both these chapters, bypassing a president and religion, but I want to honor the chronology because I want to savor this memoir of yours. Final few minutes on the podcast, Dr. Smith, what has been the most educational experience for you as you were putting this together?
As I was doing the book?
Yes.
A good question. I'm not sure. I guess I certainly learned how hard it is. But I can't say as I'm surprised by that. And one of the reasons, among many reasons, that I had never seriously thought about writing a book until now was I didn't think I had the ability to put that much of yourself into something over such a long period of time with no guaranteed reward. One of the things that surgeons get to enjoy, and probably doctors in general, is a much more immediate kind of gratification than most people in the world get. And writing a book could be the ultimate delayed gratification experience. So I think I learned that is true, and that it just gives me even more admiration for writers who have decided they want to be writers when they were 10 and do that and go through years and years of no gratification and no publisher. And they keep writing and they keep rewriting and submitting and all. And it is tough. And it's been described 1,000 different ways, the art of applying the seat of the pants to the seat of the chair and that sort of thing. But it certainly taught me the truth of what it's like to write seriously as a professional. And I don't flatter myself, at least yet, that I'm a professional in that domain.
And then you may have touched upon this, while you were answering this question, but what do you think was the most challenging aspect of writing?
At least for me, the most challenging aspect was going through, in the early stages, multiple revisions of content when there didn't appear to be an obvious, a unifying view of the people I was working with on what I was aiming for. Now, they would probably turn that right around and say, that was a problem because I didn't have a unified view of what I was trying to achieve. And I would not argue that point. But what that meant was that content came in, came out, came back in, writing thousands of words to keep 100 words. And again, I suspect that's just plain old business of writing. But when you're so accustomed to, you come in the morning, you do an operation, the operation's over, the patient does well, they go home in a couple of days or 5 or 6 days, and you do another one and the same thing happens. And you're not going back and revising one operation 50 times. And so it's a different scale of endeavor. And that was a little hard. But once we got to the point of a pretty solid first draft, well, then things became more clear. And actually, the part I enjoyed probably the most was refining what we had agreed upon once we had agreed upon it, and trying to make each chapter, each paragraph, each sentence be right. That was the part that was the easiest and most enjoyable, I'd say.
Yeah, no, just thank you for sharing your journey with us. As an author, as a surgeon, your early life. Any closing remarks? I think before we get there, for what would be your advice to physicians, doctors, surgeons who want to write? I think that's one question I wanted to ask you. For myself as well as for others who are listening who may be budding authors and writers.
Yeah, that's a great question. I have already discovered that it's one I'm being asked, and I wish I had a better answer, because I think you just have to do it. And once you know it's something you want to do, you have to find space for it in your life. And I honestly it wasn't enough of what I wanted to do that I made space for it until the pandemic. But I did the usual sort of professional writing, editorials, commentaries, scientific manuscripts on this and that and the other thing. And I've got this huge bibliography and working with other people and so on. But I never did writing like this. Never really thought I wanted to. But I think now that I've done it, it takes some dedication. It takes time and dedication, and you just have to do it and be confident is what you want to do, and then it'll probably happen. Doctors bring a lot of unique experience to topics that are relevant to people. So find a way to express them. I really don't think I'm a very good person to give advice on how to be a writer.
Well, thank you. And thanks again for your time.
No, I appreciate it. Thank you for having me.
Sure. Thanks again.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.